basically artificial.
Maybe. Hello, you're watching Wellness Watch in this episode that is aired on DD India. In the last episode, we extensively discussed spine health and ways to keep our spine strong. But what happens when your spinal cord is damaged? Your spinal cord is the cylinder-shaped tube of tissues that runs through the center of your spine from your brainstem to your lower back. It is made up of nerves and cells that carry messages from your brain to the rest of your body. Your spinal cord is one of the main parts of your nervous system. September 5th is observed as the World Spinal Cord Injury Day. It is a transformative procedure that can significantly improve the quality of life of individuals suffering from debilitating spinal conditions. With advancements in minimally invasive techniques, recovery is faster and outcomes are better than ever. Today in Wellness Watch, we discuss spinal cord surgery and injury, and I'm your anchor, Preeti. World Spinal Cord Injury Day highlights the importance of preventing injuries through education and safer environment. We as individuals can reassure patients a safe, comfortable and confident journey by providing them with the understanding of the environment for recovery. Here are more details on the patients with spinal cord injury. Take a look.
5th of September is observed as World Spinal Cord Injury Day. It is a powerful reminder of the challenges faced by individuals living with spinal cord injury. The awareness helps to prevent injuries and promote spinal health for a better life. With increase in cases around the world, it is important to create awareness about the devastating condition. An injury to the spinal cord may cause permanent or temporary disability if not managed or treated well on time. The term spinal cord injury refers to damage to the spinal cord resulting from trauma or non-traumatic causes. The extent of the injury-related impairment depends on injury severity and location in the spinal cord. As per the data provided by World Health Organization, around the world, over 15 million people are living with spinal cord injury, and around 700,000 to 1.2 million people experience a new SCI each year. In India itself, around 1.5 million people are living with a spinal cord injury in the current year, whereas almost 20,000 new cases are added each year. It is noted that road accidents account for 44 to 45% of SCIs, especially those involving two-wheelers. People with SCI are at risk of developing debilitating and even life-threatening secondary conditions which can cause premature mortality. Spinal cord injury results in complete or incomplete loss of sensory and also affects the motor functions below injury level. A person affected by SCI may face issues in controlling bowel and bladder movements. As the spine is responsible for signaling the body for breathing and maintaining blood pressure, an injury results in dysregulation of blood pressure, heart rate, and even body temperature. Another sign of a SCI is spasticity, which is motor disorder and is referred to as tightness or stiffness in muscles. People with SCI may develop clinical signs of depression, negatively impacting functional improvements and overall health. Other symptoms of a spinal cord injury include chronic pain, urinary tract infections, pressure ulcers, and respiratory complications. In case of spinal cord injury above the T6 level, person affected faces autonomic dysreflexia. The bones of a SCI patient become weak and are also prone to osteoporosis. Before we understand the cure and treatment of the spinal cord injury, it is essential to understand the types of injuries. An SCI can be either complete or incomplete. A complete injury results in permanent damage to the affected spinal cord region and can impact all four or the lower limbs of the body. In an incomplete spinal cord injury, partial spinal cord is damaged and its range of motion and degree of feeling is impacted. The cervical spinal injury is the most severe type of spinal cord injuries and impacts the upper part of the spine that contains the neck's vertebrae. An injury in lowest main segment of the spine is called the lumbar spinal injury. The patient often keeps control of their upper body but may lose some function in their lower parts. An injury in the area above the tailbone causes sacral spinal injury and may result in partial hip and leg function loss, impacting bowel movements. For those living with SCI, preventing secondary injuries caused by falls is equally critical to maintain independence and well-being. Effective prevention, treatment, rehabilitation, and ongoing healthcare are essential to alleviate the global burden of SCI. Surgery is required in certain cases to remove any fractured bones or other objects from the spine. A spinal decompression surgery may be needed to relieve pressure within the spinal column. In some cases, earlier surgery is connected to better functional recovery. By preventing falls, we not only protect the spinal cord but also preserve dreams, aspirations, and the ability to live life to its fullest. Together in our efforts, we can create a world where spinal cord injuries caused by falls are a rarity, not a reality. The spine is a pillar of your well-being and one must maintain its strength and resilience in every possible way. Bureau Report, DD India.
Alright, so the spinal cord is a vital structure responsible for transmitting signals between the brain and the rest of the body. When injuries or disorders compromise its function, they can lead to pain, mobility issues, or neurological deficits. A patient is advised spine surgery if their condition, such as severe back pain or a deformity, does not improve with treatments like physical therapy and medication. The surgery is a critical medical procedure designed to treat spinal cord injuries, deformities, or conditions affecting the spinal column. It aims to relieve pain, restore mobility, and prevent further complications. Today in Wellness Watch, we look for these answers. What causes spinal cord damage? When is spinal cord surgery needed? What are the types of spinal cord surgeries? How is spinal cord protected? And eventually, we also discuss the medical advancements in India. India offers a range of surgical options such as discectomy, laminectomy and spinal fusion, as well as advanced techniques like robotic-assisted surgery and cell therapy. Treatment plans are personalized, featuring state-of-the-art technology and extensive rehabilitation services, which include physical, occupational and psychological therapies. Up on your screens, we will have the hospitals and institutes which particularly cater to this. All India Institute of Medical Sciences, Delhi, GB Pant Hospital, Delhi, Government Spine Institute, Ahmedabad, this is part of the Civil Hospital, and Christian Medical College, Vellore. To help us understand spinal cord injuries better, we are joined in by doctors. We are joined in by Dr. Pankaj Kandwal, Professor and HOD, Spine Surgery, AIIMS, Rishikesh. He is joining us virtually. And we are also joined in by Dr. Vivek Shankar, Additional Professor of Orthopedics, AIIMS, New Delhi. Thank you both of you for joining us this afternoon. Dr. Kandwal, to you first. In very simple, brief terms, explain to our viewers what is spinal cord. Do we consider it as an organ?
Hi, good afternoon everyone. Thanks for the introduction. Spinal cord indeed is an organ, and it is a connection between your brain and your lower limb and upper limb. It is, when you go down from the brain, you have brain stem, and then it's followed by the spinal cord, which goes all the way to L1, and from there you have various nerve roots which supply the upper limb and lower limb. So it's basically a connection between brain and the limbs.
All right, it is the connection. What causes spinal cord damage? Dr. Shankar, to you this question.
Look, spinal cord damage can be caused by either trauma, as you explained earlier, or because of some other disease process like degenerative changes, which is encompassing on the spinal cord and compressing so much that the vitality of the spinal cord is compromised. Other than that, tumor can also cause spinal cord injury. Then there are some certain situations like spondylolisthesis, where the spinal cord alignment is deranged. That also may lead to progressive spinal cord injury. So there are multiple factors which can affect spinal cord injury. Primarily, the most common factor is trauma, and trauma can occur right from the base of the skull, where the spinal cord forms, until the coccyx, where the spinal cord ends,
right.
where the chorda equina ends. So these are the main causes of spinal cord injury.
All right, Dr. Kanwal, how is the spinal cord protected?
Naturally, spinal cord is protected by the bone, or which is the vertebral column. It's well protected inside the vertebral column, and there has to be a big impact on the vertebral column for the spinal cord to get damaged.
All right, Dr. Shankar, is spinal cord injury the same as a spine injury?
Spine injury and spinal cord injury are usually used synonymously, primarily because any injury to the spine leads to spinal cord injury, and until there is some compromise in the vertebral column, apart from any tumor which is developing inside the spinal cord,
right.
Usually the cord injury occurs because there is some disruption in the spinal column, as sir said. So it can be used synonymously, apart from if there is a tumor.
All right, I'll take that forward to Dr. Kanwal. Dr. Kanwal, if a person is suffering backache, it is not a symptom of spinal cord injury or something that is affecting the spinal cord. What are the symptoms that a person should look for when, in particular, the spinal cord is in danger?
See, I think Dr. Vivek was trying to tell you two things. Spinal cord can get injured after trauma. The history is very clear. The trauma has to be high impact trauma. It has to be either fall from height, or it could be a motor vehicle accident, which is obviously on a rise nowadays in India. But fall from height and motor vehicle accident, these are the two major causes of spinal cord injury, and the history is very clear. Symptoms are very clear in those cases. Now, as Dr. Shankar was trying to say, spinal cord can be injured in other issues also, like tuberculosis, or it could be degenerated spine, or rarely tumors also. Their symptoms could be anywhere from backache. You can have constitutional symptoms like fever or weight loss. Those things can be there in case you are suffering from tuberculosis or a tumor. But I think for practical purposes, we should limit our discussion to spinal cord injury, which is primarily because of high velocity trauma or fall from height.
All right, does a spinal cord injury also lead to paralysis of any kind? Dr. Kanwal.
Yeah, so I think it was very nicely summarized in the initial part. The spinal cord can get injured at the cervical spine, at the neck region. It can get injured at the dorsal or the thoracic spine, thoracic region, or it could get injured in the lumbar or lower part of the spine. Now, if the neck is fractured, that means you will have weakness in both the upper limbs and lower limbs, which we call as quadriparesis or quadriplegia. Quadriplegia means all the functions are gone in all the four limbs. Paralysis means there are some movements or some function which are preserved. Now, if the injury is in the dorsal spine, which is the rib cage, which everyone can understand, or lower spine, you can have weakness of both the lower limbs, which is called as paraplegia, which is complete loss of function below certain level, and both the limbs the patient cannot move both the limbs. He may have bowel bladder symptoms also. So that is about paraplegia and quadriplegia.
Right. Dr. Shankar, can a spinal cord injury heal by itself, one, and secondly, when is it the time for the surgery to be initiated?
So, as Dr. Pankaj sir has said, if there is paralysis, either quadriparesis or paraparesis, then if the decompression is done or if the alignment is maintained by its by traction or by any other means or by self, then the recovery may occur, and that depends upon the kind of injury, the extent of injury the spinal cord has suffered. But in plegia, when we use the word plegia, where there is a loss of function, then decompression may be required to have a good recovery. That also depends upon how early the decompression is done. It's like the compression, if the compression is more and if the compression is for a greater duration of time, the loss of function will remain more and the recovery would be protracted. That will take longer time for recover, and the extent of recovery would be inversely proportional to the time of compression.
Right. When we talk of spinal cord injuries, does the injury also affect the respiratory system or other systems of the body?
If the as Dr. Pankaj has said, if this cord injury is at a higher level,
yes,
in the cervical spine and at the level of C1, C2, then the respiratory function may get affected. If the level of injury is lower, below the thoracic level or at the thoracic level, the respiratory system usually is not compromised unless the impact of injury is so much that it has impacted the lung also, and there are other associated injuries in the rib or the chest. But as per se in the thoracic spine or the lumbar spine, the respiratory function is not that much affected. The extent of injury determines the function of the body. So, if the extent of injury in the cervical spine, then the upper and lower limb both are affected, because whole of the canal, whole of the cord is passing through the cervical spine. The nerve which supply the upper limb, they exit in the cervical spine. So, if the cervical spine is affected, then both the upper limb and the lower limb is affected.
Yes, right.
But as you go down in the thoracic spine, the nerve which is supplying the upper limb is already exited. So, if the injury is at the lower level below the cervical spine, then the lower limb is more affected.
All right. Very aptly explained. But then, sir, does a deformity in the spine also always lead to, lead to pressure on the spinal cord, can lead to spinal cord injury, one? And in our day-to-day lives, how can we protect ourselves from, getting our spinal cord damaged or for that matter affected?
Okay, thank you for asking this question. It's a very, burning question at this point of time, when we are hooked on mobiles and laptops.
Yes.
So, to answer the question, I think the protection is very important. Coming to the first question of deformity, the longer the deformity is there, the more pressure is there. So, there are two kinds of deformity that occurs in spine, whether there is a scoliosis or a kyphosis, and there is a mixture of deformity which is called kyphoscoliosis. So, the deformity can be congenital, where the deformity is right from the birth, and it developmental, where the deformity develops over a period of time. Then deformity can be static and progressive, and then there are deformities which are defined as adult deformities, so which develops over a period of time because of posture, because of osteoporosis or other factors. Now, the congenital deformity usually, if it is very severe, may lead to neurological deficit because of the pressure,
Pressure.
it is causing on the spinal cord primarily. And also because the deformity is, the spine is a three-dimensional structure. So, because of the three-dimensional deformity. So, we need to correct the three-dimensional structure to have good decompression of the spine, so that deformity does not cause
Pressure.
pressure
Yes.
symptoms. In the adult deformities, in the adult
Adult cases, yes.
cases, what happens is, because of postural problem, the primarily I'll come to the cervical spine first. So, the adult cases where the people are using more of the mobile, where the neck is flexed more of the time, people go to sleep, and in bed also they tend to use mobile. The flexion of the neck causes compression of the cervical spine. They develop cervical not only deformity, there are humpbacks, there are neurological problems both in the upper limb, pain starts during that period. People who work for long hours sitting on chair with a bad posture tend to develop not only deformity but symptoms related to lumbar canal stenosis, and then they develop progressive neurological problems.
Right.
So, both of the things, we have to define what kind of deformity is there, what is the age at which the deformity has developed, and what is the cause of deformity, and then what is the symptom that is occurring.
Right, very well explained in detail. Dr. Kanwal, what are the medical advancements that have been made in India with regard to when we talk of spinal cord injury and surgeries?
Well, I think spinal cord injury, as was discussed before, is one of the devastating thing for any patient. It's a big economic burden on the family. Plus, rehabilitation is something which needs a lot of focus for the better functional outcome of these patients. Again, spinal cord injury is a permanent damage to the spinal cord, and you don't expect much to get better even with surgery in case there is complete loss of function. Since this is a problem, there have been enough research happening how we can regenerate the spinal cord, how can we get the function back. There has been several research happening world over on role of stem cells, robotic rehabilitation. There are I've been reading about use of exoskeleton for getting the function back. So, but all in all, most of the or there are a lot of pharmacological agents, newer things which can help in regeneration of the spinal cord. But unfortunately, we are still groping in the dark, and most of the research or focus should be on rehabilitation of these patients so that they regain some function. It could be getting their bladder control back or some function by which they are independent on themselves.
All right, so you're talking of this rehabilitation. Does this rehabilitation, carry on lifelong after the surgery, or to put it otherwise, how long does the recovery take?
Again, the recovery depends on whether there is an incomplete loss of function or complete loss of function. If it's incomplete loss of function, we are hopeful that the patient will regain the function and he can be back on his toes, on his limbs, on his feet. But if the injury is complete, the entire aim of rehabilitation is functional independence. He should be able to get up from the bed and go to the wheelchair to bed, his upper limb strengthening, core muscle strengthening, trunk muscles. So the entire rehabilitation goal for a complete paraplegia is just getting back his functional independence. While incomplete paraplegia, we aim for neurological recovery and for them to stand on their feet as soon as possible.
All right, so for our viewers who've just joined in, we have doctors today explaining to us in detail about spinal cord injury and what has to be done to prevent it. I will also ask quick rapid fire questions for some myths of our viewers to be busted. Dr. Kanwal, to you first. Spinal cord injuries only happen to athletes or in traumatic accidents. Is it true?
It happens majorly in traumatic accidents. It
All
could be, as I said, motor vehicle accident, or it could be fall from height.
Dr. Shankar, only young people can recover from spinal cord injuries.
That's not true. Anybody can recover from spinal cord injury depending upon the kind of spinal cord injury.
Paralysis means the spinal cord is completely severed. Is it so, Dr. Kanwal?
Yes, maybe. But as I said, if the spinal shock is over, if it was a concussion, it was like hit and go, patient can get better. But if there is a anatomical, what do you call it, anatomical disturbance of the spinal cord, invariably they do not get better.
Spinal cord injury is a lifelong condition with no hope for improvement. Dr. Shankar?
No, if the spinal cord injury is incomplete, there is absolutely a very good hope for improvement. But as Dr. Pankaj said, if it is a complete injury, you have to do rehabilitation to get back to your life as much as possible.
SCI only affects physical abilities and not the mental health. Dr. Kanwal?
Wrong. It majorly affects mental health. Patients do get devastated, not only physically, but emotionally and psychologically they are affected. So it is mainly mental.
Right. People with spinal cord injury are constantly in pain and cannot have a fulfilling life, Dr. Shankar.
If they have recovered, they will have fulfilling life. If they have not recovered, then there is loss of sensation. The pain goes, but the function is also impaired.
All right, we'll end this discussion here. Thank you so much, both of you, for joining us on Wellness Watch today afternoon and helping us understand spinal cord injuries better. So after the discussion, we did understand that the spinal cord is more than just the body's information highway. It is the silent guardian of movement, sensation and strength. Protecting your spine means protecting your freedom to walk, work and live a wholesome life where we can stand tall, walk freely and live without limits. Remember, protect your spine and protect your shine. With that, we end this edition here. Thanks for watching.